Q. The client with an ileostomy is being discharged. Which teaching should be included in the plan of care? A. Use carry a powder to seal the bag. B. Irrigate the ileostomy daily. C. Stomadhesive is the best skin protector. D. Neosporin ointment can be used to protect the skin. Rationale: the best protector for the client with an ileostomy to use is stomadhesive. Answer A is not correct because the bag will not seal if the client uses carrier powder. Answer B is incorrect because there is no need to irrigate an ileostomy. Neosporin, answer D, is not used to protect the skin because it is an antibiotic. QA Gravidail Para0 is admitted to the labor and delivery unit. The doctor performs an amniotomy. Which observation would the nurse expect to make after the amniotomy? A fetal heart tones 160 bpm. B. A moderate amount of straw, colored fluid. C. A small amount of greenish fluid. D. Small segment of the umbilical cord. Rationale: normal amniotic fluid is straw-colored and odorless. An amniotomy is an artificial rupture of membranes. Fetal heart tones of 160 indicate tachycardia, so answer A is incorrect. Greenish fluid is indicative of meconium, so answer C is incorrect. If the nurse notes the umbilical cord, the client is experiencing a prolapsed cord. This would need to be reported immediately, therefore, answer D is incorrect. QA client has signs of increased intracranial pressure. Which one of the following is an early indicator of increased intracranial pressure? A. Widening pulse pressure. B. Decrease in the pulse rate. C. Dilated, fixed pupils. D. Decrease in level of consciousness. Rationale: the nurse observes sluggishness and lethargy as early indications of increased ICP in a client. A change in vital signs and papillary changes, as in answers A, B, and C, are late signs of increased ICP. Q. The nurse is obtaining a history of an 80-year-old client. Which statement made by the client might indicate a possible fluid and electrolyte imbalance? A. My skin is always so dry. B. I often use a laxative for constipation. C. I have always liked to drink a lot of iced tea. D. I sometimes have a problem with dribbling urine. Rationale: frequent use of laxatives can lead to diarrhea and electrolyte loss. Answers A, C, and D are not of particular significance in this case and, therefore, are incorrect. QA client has just returned from a bronchoscopy. Which safety measure is most important for the nurse to implement? A. Maintaining the client in the supine position. B. Providing the client with saline gargles every 15 minutes for 2 hours. C. Monitoring the client for return of the gag reflex before PO intake. D. Splinting the abdomen when coughing. Rationale: A. Loss of gag reflex can occur due to the anesthetizing agent used for the tube insertion. It is most important to ensure an intact reflex before administering food or fluids because of the danger of aspiration. The position in and swirl would be contraindicated because of possible increased secretions. Answer B would be instituted at a later time. Answer D would be necessary for clients with abdominal surgery. Q. Alcohol, caffeine, or drugs are high-risk factors that all fall under which broad classification of risk factors? A. Social demographic. B. Environmental. C. Biophysical. D. Psychosocial. Rationale: psychosocial risk factors include lifestyle choices like the use or abuse of alcohol, caffeine and illicit drugs in addition to smoking, and psychological status. Low income, age, and ethnicity are social-demographic risk factors. Secondhand smoke and air pollution are environmental risk factors. And biophysical risk factors include genetic considerations, nutritional status and disorders such as diabetes. Q. The nurse is preparing a client with an axillo-popliteal bypass graft for discharge. The client should be taught to avoid A. Using a recliner to rest. B. Resting in supine position. C. Sitting in a straight chair. D. Sleeping in right Sims position. Rationale: the client with a femoral popliteal bypass graft should avoid activities that can occlude the femoral artery graft. Sitting in the straight chair and wearing tight clothes are prohibited for this reason. Resting in a supine position, resting in a recliner, or sleeping in right sims are allowed, as stated in answers A, B, and D. Q. The client with diabetes is preparing for discharge. During discharge teaching, the nurse assesses the client's ability to care for himself. Which statement made by the client would indicate a need for follow-up after discharge? A. I live by myself. B. I have trouble seeing. C. I have a cat in the house with me. D. I usually drive myself to the doctor. Rationale. A client with diabetes who has trouble seeing would require follow-up after discharge. The lack of visual acuity for the client preparing and injecting insulin might require help. Answers A, C, and D will not prevent the client from being able to care for himself and, thus, are incorrect. Q. During which week does the fetal heart begin pumping its own blood? A. 3rd week. B. 5th week. C. 9th week. D. 6th week. Rationale. The embryonic heart begins pumping its own blood, often a different blood type than the mother's, during week 3. Week 5 includes the development of eyes, legs, and hands. Brain waves become detectable during week 6 and teeth begin to develop during week 9 of gestation. Q. A client with COPD is in respiratory failure. Which of the following results would be the most sensitive indicator that the client will probably be placed on a mechanical ventilator? A. PCO 258. B. SAO 290. C. pH 7.23. D. CO 330. Rationale. The pH is an accurate indicator of acute ventilatory failure and a need for mechanical ventilation. An elevated PCO2, as in answer A, is not an adequate criterion for institution of ventilator support. Answer B.